looks like it's not an infection. There's no redness. It's just like this huge growth on the upper lip. And then when I opened it up, it looks like a mass that needs to be removed. I did give him a referral to the oral surgeon, so they're probably gonna biopsy. They're gonna take that tissue out and biopsy it, and they'll take out that growth. So we'll see how that goes. Hello guys, and welcome back to the channel. If you are new today, my name is Andy. I am a family nurse practitioner. Today I'm gonna hang out with you. I'm going to the clinic, so come on, let's go. Alright guys, so I have arrived in the office. So typically what I do, of course, is turn on my computer, put my badge on, put on my mask because that's important. I always like to wear my mask, use my hand sanitizer, and then I just log in and kind of go through my schedule for the day, see what's on the schedule for me. Sometimes I'm able to review my patients to see who I'm seeing that day, sometimes I'm not. So I just most of the times catch up with like paperwork, or maybe if there's a note that I couldn't finish the previous day, I'll try to do that, or maybe send medication, or maybe review labs. So anything that I can do just for that few minutes before I start seeing patients, which is what I'm doing right now. So at this point I have started seeing my patients, so I'll see you guys. Alright, guys, so it's been an interesting day today, definitely. So, when I first initially came in, I had a patient that I had seen for hepatitis C that wanted to start treatment, but I wasn't sure if it was chronic or not. So, I had requested some paperwork from him, like past lab work, and that is what I was reviewing earlier in the video. I see that he was diagnosed in 2016, so definitely he will be able to start treatment right away. So what I did was I did prior authorization for his medication. I requested the medications for him, so we should be able to start treatment right away. So today I had a patient that came in because she was afraid that her IUD had probably dislodged because she couldn't feel the string, and she just wanted to make sure that the IUD was still in place. So basically what I did for her was IUD check, and I did see the string. It was just a little bit inside, so I had to pull it back out and make sure that the IUD was still in place for her. She is thinking of trying another baby, or she is thinking of trying for another baby, so she will be back anyway to have the IUD removed. I could not remove it today because that is a completely different type of appointment. It has to be like a 40-minute slot because it is considered a procedure, so we weren't able to do that today. I also had another patient that wanted birth control, so she wanted to go on the pill. Usually we have like a little handout that we do give patients if they're thinking of birth control, and this is what I'm just showing you guys here. It has different options for like IUD pills, whatever they would like, so I usually give them that to review. So today was really interesting. I really enjoyed I saw a lot of patients today, probably like 16 or 18, I can't remember, but it was very interesting. So now I'm just driving home for the day has ended, so I'm on my way home. There's a whole lot of traffic. I'm going to pick up my son, and then I will see you guys tomorrow. So we'll continue this tomorrow. See you guys. Hello guys, welcome. Today is Tuesday. I'm about to head into work, but I want to get my things ready. I need to drop off my son, so I have to get his stuff ready. Today is my late day, so it is about 8:40, 8:41. It is my late day. I get in at 10. On a regular day, I get in at 8 and I start clinic. I start seeing patient at 8:20. But every Tuesday I go in at 10. I start seeing
Sometimes
patients,
we do that.
and I start seeing patients at 10:20. So, and I don't finish till 7. So yeah. All right, guys, so I have reached the end of my day today. I saw a lot of patients today, and I'm just gonna go over some interesting case that I saw today. So I saw a patient that came in with cluster headaches. I haven't seen cluster headaches in a long time. So basically, she was complaining of headaches on the right side of her head always. And when that happens, sometimes she'll tear up. She'll have some, congestion, teary eyes, and stuff like that. So that's the classic symptoms of cluster headache, which kind of mimics migraine. So we discussed that, set her up for something to take for the headaches, and of course, recommended rests, water. She needs to drink some water and rest, and try to distress as much as she can. Another interesting case that I saw today was a patient that has that I diagnosed today with diabetes. So this patient did not come in for diabetes. Actually, came in because she thought she had UTI. She had a lot of discharge, yeast infection, like yeast rash in the front and behind, and basically that's what brought her in. So I decided to get a UA had a lot of glucose greater than 1,000, so I decided to go ahead and do A1C came back greater than 14%, which is basically really bad diabetes, uncontrolled diabetes. She does have a history of gestational diabetes. She wasn't on medication at that time. When she was pregnant, she was controlling it with diet. I looked it up, and her last A1C was done in like 2020, and it was at 5. So basically, she was doing pretty good, but now she has full-blown diabetes. And one of the symptoms, right, another thing that clued me into the diabetes, apart from the glucose being 1,000, greater than 1,000, which is a really pointing sign anyway in her urine, because that means that the glucose, her sugar is so uncontrolled that it's leaking to her urine. Okay, so she's now having sugar coming out of her urine. Another thing was the yeast infection. Yeast loves sugar. So when the body has uncontrolled diabetes, which means the sugar is just floating everywhere, the person is more likely to develop yeast infection. So she not only had yeast, but she also had bacterial vaginosis, which again, when you have uncontrolled diabetes, it's easy for your body to have infection. So yeah, that was really interesting. So of course, I started her on 2 medications today. Ideally, she's supposed to start insulin because the diabetes, because A1C is greater than 14%, but some patients, for some reason, they're very resistant to starting insulin. Medication that I know that I love to use, of course, the basic medication that I use for diabetes is metformin classic. We start with that, but I also added Januvia. It's a very good medication, but it can cause yeast infections, but it's very good at getting the blood sugar down without hypoglycemia. So we starting her with I started her on Januvia and metformin and brought her back. I schedule her to come back in a month, and we'll see how she does. I recently did have that same kind of case without the yeast infection and the yeast issues. The patient also, I started with Januvia and metformin. For the first time, I had someone that actually reacted to Januvia. She had a lot of rash, so I had to stop that. And so that's another thing that you should look out for if your patient starts a medication like Januvia and comes back with like hives or rash, broken down rash all over. It's most likely the Januvia. So my last patient was very interesting. So he said that he had a growth on his upper lip since when he was little. It's kind of been there, it's kind of been stable, but recently he got into a fight. He's like 30 something now, got into a fight and someone punched the upper lip. Now the growth is just getting, like, the lip just started getting bigger and bigger. So when I looked at it, it looks like it's not an infection. There's no redness. It's just like this huge growth on the upper lip. And then when I opened it up, it looks like a mass that needs to be removed, unfortunately. Looks like he has tooth infection right here. Gave him some augmentin. Of course, I also referred him to oral surgery because I think that's I definitely know that's a growth. I just hope it's not cancerous. So they're probably gonna biopsy. They're gonna take that tissue out and biopsy it, and they'll take out that growth. So we'll see how that goes. So anyway, that was my day for today. I hope that was interesting to you. Don't forget to like, share, and subscribe. Until my next video, I love you with the love of God.